And good afternoon. It is time for our lunch and learn. Now, just be forewarned, this could be 2, maybe 3 sessions. It just depends on how far we get today. And so we're going to be talking about thyroid brain. Now, your thyroid gland is right here. It's a butterfly shaped gland and it regulates a lot of different things in the body. And so if your thyroid is not working right, it affects many other things. And I learned quite a bit in this article. And so I wanted to share this with you because most holistic practitioners believe that there is probably 80% of women for sure who are walking around with undiagnosed thyroid conditions. And so when it's undiagnosed, then you're not doing anything about it. Your doctor is going to say, well, there's no reason to do anything about it because you are within the normal reference range. So just for future reference, the medical reference range for TSH stands for thyroid stimulating hormone. TSH on the normal reference range is, I think it's 0.4 to 4.5. I think that's the standard reference range from the medical perspective. Holistically, we want your TSH to be between 1 and 2. So our range for normal function is really, really tiny. And if you have a thyroid functioning at 3 or 4 or even 4.5, which is way out of range holistically, your medical doctor is still not going to do anything because according to their standards, you are within normal range. Now, your thyroid helps a lot of other things happen, but there are other glands too in your brain, your pituitary and your hypothalamus and your adrenals. Now, your adrenals sit on top of your kidney. Those 3 things are called the HPA axis. If the HPA axis is not functioning properly, their hormone cascade is not doing what it needs to do, then you're not going to produce enough thyroid hormone. So medically speaking, when you go to the doctor and your thyroid is out of reference range, they're going to give you probably a synthetic hormone to help that function. I think it is a T4, and I think it's called Synthroid. That's what they normally do because that's what insurance will pay for. It is synthetic, and we're going to talk about some different things about that supplement. So in medical terms, your physician is going to keep increasing your levothyroxine until you get the desired result. Now, I have heard from medical doctors, I've been in seminars with them who say that the way that the conventional medical doctor treats thyroid dysfunction is not helpful to the body because it does not address the HPA axis. If the HPA axis is off, no amount of levothyroxine is going to help you on a continual basis. So these are some things that you need to know so that you can make the best decision for yourself. Again, I am not a medical person. I am a researcher. I am a holistic practitioner. And so this is for information only so that you can be armed and you can go back to your endocrinologist and say, what about this? What about that? What about the other? And then you can kind of move forward on that. So hypothyroidism is what they call low functioning thyroid. The higher your TSH is on your lab report, I've seen it as high as 30 something, right? So medically speaking, it should be, between 1 and 4 or between 1 and 2, which is what we like to see. I've seen 34. I've seen 19. I've seen it be really out of whack, and that is not good. Hopefully you're not like that. All right. If you are that far out of balance, you are going to need medical intervention because holistic does just not work that fast. And so while we work slowly, and you're going to need some immediate relief because of all these conditions we're going to talk about. So you might have thyroid brain, right? Sounds like you might be a redneck, right? No offense to Jeff Foxworthy. You might have thyroid brain if you have brain fog. So get a piece of paper and write down the symptoms that you have, and then we'll kind of see where we go with this. All right. You might have brain fog, fatigue, depression, slow mental speed, poor brain endurance. Now, this would be something that you do something like you read a chapter and you're just exhausted, or you work a crossword puzzle and you're just exhausted. So poor brain endurance. This means that you tire easily when reading, driving, working, or being in noisy areas. Now, I know a lady that does have thyroid dysfunction and noise hurts her. Going to a restaurant, going to the theater, anything like that, she just doesn't like the noise. And it's all because her thyroid is out. Worsening memory, anxiety, sleep problems, low motivation, irritable or grouchy. Nobody's irritable or grouchy these days, right? Worsening balance. You drop things easily. If you just can't hold on to something, you're always dropping something. That could be a thyroid issue. Your handwriting is getting worse. Now, that was a new one to me because I have seen the elderly lose their handwriting ability. My late husband lost his handwriting ability, but he had a brain tumor. So I put that down to that. But this is a symptom of what they're calling thyroid brain. Worsening muscle function. So if your muscles are not functioning properly, brain symptoms after eating certain foods, you become confused and that kind of thing. And then chronic gut symptoms. Now, we know, and you've seen me show the graphic, the ripple effect before, and the ripple effect says if you have good digestion, you're going to absorb your nutrients, you're going to have energy and repair, and you're going to have health. If you have poor gut issues, then you're going to have toxicity, inflammation, and then just a whole host of diseases here. So gut problems are real world issues. Almost everybody we see has a gut problem. And that's because of all the garbage that we eat. We eat genetically modified foods. We eat foods that aren't really foods. We eat synthetic foods. Anything that comes in a box or a package has a lot of preservatives in it. So preservatives are not something that we are supposed to eat. And so when we consume those kind of things, I was talking to a young lady yesterday and she loves ramen noodles. Well, ramen noodles have zero nutritional value that you buy in the store. A lot of people get them at the dollar store and you add hot water to it. It reconstitutes it. There's no nutritional value in that. And it's really, really high in sodium. So if you have high blood pressure, you really need to think twice about doing that. All right. So when you have thyroid, these are the symptoms that you normally think of. You think of thinning hair. You think of fragile nails. You think of fatigue. You think of constipation. You think of being sensitive to cold. You think of having ridges on your nails. Now, so many of us do our nails, so it's really hard to see. And you have to look at your toenails for that. But also when you stick out your tongue, if your tongue has ruffled edges, that's a symptom of thyroid disease. If you're losing the outer third of your eyebrow, and a lot of men do this. Women, we paint ours on, so you can't really tell. But with the men, you can tell because they don't do that. You can tell when they're losing the last third of the eyebrow. That's another functional symptom of low thyroid there. You also need to know that every cell in your body depends on thyroid hormones to function. Now, that was new to me. I mean, I've done all kinds of anatomy classes. I've done all kinds of biology classes, but I had no idea that every cell in your body responded to thyroid hormones. And this is something that you need to know. The writers of this article, and they are, it's a PhD, chiropractor, all kinds of ABCs at the back of his name. Dadis Karazazan, I'll probably mess that up. But anyway, he is a Harvard Medical School trained, award-winning clinical research scientist, academic professor, world-renowned functional medicine healthcare provider. So he is the one that gave us all this information. So it's really worthwhile noting. So it says, however, for the estimated 5% of the population with hypothyroidism, a condition in which the thyroid gland doesn't produce enough thyroid hormone, it's like your gas tank running on fumes. And I think that is a misprint because it's talking about 5% of the population. We think that 80 to 85% of women, which are, as last I looked, was about half of the population, they have undiagnosed thyroid dysfunction. So we talked about hypo, which is low thyroid dysfunction. There's also hyper, which is too much thyroid hormone. And so when you produce too much, it's just, you get Graves' disease and all kinds of things. Graves' disease and Hashimoto's are both autoimmune disease. So when your thyroid is not functioning properly and it's left unchecked, then you're going to have one or two possibilities of autoimmune disease. We don't want autoimmune disease, people. I'm just telling you, you don't want that. As many as 60% of people, they say, have hypothyroidism and don't know they have it. I think it's more like 80%, but we're not going to argue that point. So if you have any of those, that list that we talked about a while ago, you might be a person that has that. So declining brain function can have multiple underlying causes. If lab tests show that your thyroid stimulating hormone is above 3, you also have symptoms such as constipation, hair loss, feeling cold all the time, you need to seriously consider the impact of the potential thyroid hormone deficiency on your brain. Now, there are a lot of things that affect our brain. As we get older, our brain is just, you've got problems. You could have had a concussion. You could have had a traumatic brain injury. You could have had some TIAs. All of those things are common as we get older. So fortunately, we do have a supplement that opens up the lymphatic drainage of the brain. There are supplements out there that will eat away at the tau proteins that develop in the brain. If you have heavy metal toxicity, then that's going to affect the brain. If you have diabetes, then that's going to affect the brain. So a lot of things affect the brain. So we really want to help you have good brain health because your brain is like mission control here, right? The doctor says, more than 90% of hypothyroid cases are caused by an autoimmune disease called Hashimoto's, which is identified by a positive thyroid peroxidase and or thyroglobulin antibodies on your lab test. Now, I'm just going to tell you, most practitioners do not test for that, okay? They just don't test for that. They will test your TSH. They probably test your free T4 because your free T4 responds or it manipulates into T3, which is the hormone that your body uses most of. So they'll look to see if you have enough T4 in your system. But there's T4, there's T3, total T4, total T3, free T3, free T4. T3 reuptake. There is reverse T3. There's all kinds of thyroid numbers that they never test for. And it is the antibodies that you're going to do on an ANA antibody test. They're going to see if there is cause for autoimmune. That's how you diagnose that. So you can have a slow thyroid but not be in Hashimoto's. You can have a fast thyroid and not be in Graves' disease, but you're going to have that test to know for sure. Most doctors don't do that. And why is that? Because they're not going to treat you any differently. I'm going to tell you, as a holistic practitioner, you are going to function differently if your thyroid is just low or if you actually have an autoimmune disease. Now, on your periodic chart, all right, go back to your chemistry, high school chemistry. You've got the periodic chart. You've got the halogens, which is, if you're looking at the chart, it's like the last column on the right. If you're looking at the chart, it's been a long time since I looked at the chart, but that's what my memory says. So in that chart, you've got iodine, you've got bromine, you've got chlorine, you've got fluoride. Okay. So those are the kind of things that the elements that are in the halogens. They all have the same valence electron structure, right? So that's all chemistry. You need to look at that. What that means is that in your thyroid gland that has iodine receptors, if you drink a lot of chlorinated water, if you eat bread a lot, if you use fluoride in your toothpaste, all of those chemicals are going to fill up the iodine receptors in your thyroid. And so you're not going to be able to have iodine there. Now, iodine feeds your thyroid. Iodine actually feeds all the cells in your body, all the glands in your body. So your glands are what produces a hormone. So that is your thyroid, your parathyroid, your adrenals, your ovaries, your testicles, your hypothalamus, your pituitary, your pineal gland, your pancreas. All of those glands secrete hormones. And so you've got to have iodine to make sure that you secrete all those hormones. So if you're the standard person, you eat bread, you use fluoride in your toothpaste, you chlorinate your water, or you bathe in chlorinated water. You might have, moved forward, you're drinking filtered water, you filter your water, but if you're not filtering your bath water, you're not filtering your whole house water, then you've got some issues with that, okay? And so those are the kind of things that you need to look at. If those factors are you, then your thyroid receptor glands are full of fluoride, chlorine, and bromide. Now, why bromide? Well, because bakers now put bromine in the bread as a rising agent. And so if you eat a lot of bread, you're going to fill up those thyroid receptor cells with those elements. So you're not going to have any place for the iodine to go. This is why iodine supplementation is so critical to health. There is a book out there. I certainly want everybody that has thyroid issues, right, diagnosed or undiagnosed, to get this book. It's called Iodine: Why You Need It and Why You Can't Live Without It. It is authored by Dr. David Brownstein of the Cleveland Clinic. He is like the guru on iodine. He tells you how to do a 24-hour urine catch, so we find out how much iodine you are absolutely absorbing. And he said he's never had a patient that initially came into him that had enough iodine in their system. So I think that we can safely say that we all need to supplement with iodine. Now, I'm already hearing somebody say, oh, but Dr. Polly, I'm allergic to iodine. And I'm going to tell you that you may be allergic to synthetic iodine, but you cannot be allergic to organic iodine because every cell in your body requires that. And so that's something that you need to look a little bit deeper and find out the whys and the wherefores for that. So I went off script a little bit there, but I did that so that you would have some understanding, because you may think you're healthy. You may say your doctor says that your thyroid numbers are fine. Don't want to argue that point with you. What I want you to understand is if you have any of those symptoms, you may be having a thyroid brain issue. And if you supplement appropriately, you could alleviate all of that. And so that's really, really important. Now, an autoimmune disease is when your immune system is confused. All right. A healthy person, the immune system attacks invading things, a bacteria, a virus, a pathogen, a fungus, a mold, whatever. The body's going to mount a response to that, and the body's going to overcome that. When the body has too many toxins and it can't figure out what it's supposed to do, it flips over into an autoimmune state and starts attacking itself. You can attack your thyroid, which we talked about. You can also Crohn's disease, IBS. All right. All of that is autoimmune. Diabetes can be autoimmune, certainly type 1 diabetes. And so you need to know these things so that you can be really prepared and you can attack the cause of the dysfunction and not just mask it with pharmaceuticals. All right. So What causes the body to become confused? Well, the body's not eliminating properly. You're not pooping properly. Your liver's not being decongested properly. Your gallbladder's not decongesting. Your kidney, your bladder are not working properly. Your lungs are not working properly. You don't sweat. There are a lot of people that come in here to the clinic and they don't sweat. Well, if you don't sweat, you're not getting rid of all those impurities. And so all of that toxicity is going to make the body confused. We all live in a toxic environment. I mean, I'm surrounded by Wi-Fi in my office. We've got carpet on the floor. We've got synthetic furnishings because that's what we have. I've got all kinds of electronic equipment on my desk. And so it is a dirty atmosphere. If I'm eliminating properly, if I'm nourishing myself properly, if I'm uptaking all my nourishment properly, then I have what I need to be able to detoxify properly, right? So that everything's going to whatever I ingest that's not right, whatever I breathe in that's not right, whatever I put on my skin that's not quite right. It's going to all flow through the emunctory cycles because that's how the body keeps itself healthy. When you've got over toxicity, when you've got inflammation, then you've got too many things that the body doesn't like. So the body flips and starts attacking itself. And this is what we don't want. The author goes on to say, in most cases, autoimmunity can be driven into remission through diet, lifestyle, mental strategies such as meditation and mindfulness. So this is really good to know. We have seen on blood work that people come in with ANA antibody tests, TPO tests, thyroid peroxidase antibodies, that they come in and those numbers are really, really high. And we see after a course of supplementation, maybe 9 months, maybe even a little bit longer, we see those ANA antibodies come down. All right. That's hardly ever seen. Your medical doctor will tell you that once you have an autoimmune disease, you have it for the rest of your life. But I'm here to tell you that we have seen legitimate blood work that shows that the ANA antibody come down. And while they might not be zero, they are certainly under the threshold of disease diagnosis. So that is something that we all look forward to. That is something that we can do through diet, we can do through supplementation and all of that kind of thing. He says, most doctors only test for the thyroid hormone TSH because they're not going to treat you any other way. And I told you that a while ago. He says that supplementation with the synthetic levothyroxine, all right, does not address the damage from autoimmune attacks against the thyroid. And this explains why many patients continually need to have their dose of thyroid medication increased, all right? And so we talked about that. So there are several dysfunctions in your brain, all right? And we want our brain to be so healthy. If the brain is not getting enough thyroid hormone, it will not function. The immune cells that destroy the thyroid in unmanaged Hashimoto's also, all right, target your brain tissue. So did you hear that? Hashimoto's, those cells that target your thyroid, what is the immune system supposed to do? It's supposed to eat up, gobble up everything that's not supposed to be in the body. So it attacks your thyroid. It also attacks your brain cells. You know, we don't want that. Unmanaged Hashimoto's is inflammatory for the whole body. This can inflame the brain, causing symptoms and aging the brain too quickly. None of us have time for that, right? We don't want our brain to be aged. Many people with Hashimoto's have multiple food sensitivities as well as chemical sensitivities. So failing to identify and address these can also inflame the brain. Now, a chemical sensitivity, again, is because you are not eliminating properly. And so the body gets overwhelmed and it mounts an inflammatory response or an allergic response to those particular substances. If it is a food allergy, it could be because, as I said earlier, the toxicity of our food causes the gut lining to become permeable. Your gut lining should not be permeable. What do I mean by that? I mean that the strictures you've got, like, think of shingles that line the inside of your gut, your GI tract. When they're functioning, they're tight like this, and nothing can pass through them into the outside world, into your bloodstream. They're supposed to pass through your intestines, right? Through the tube, your small intestine, your large intestine, but they're not supposed to go out through the outside of your intestines into the bloodstream. And so this is what we get when we get leaky gut. So a good, healthy gut looks like this. Forget about thumbs, right? But when you've got a permeable gut, you've got gaps. And when you have gaps, then the food particles seep through those gaps. The blood recognizes those proteins as not supposed to be there. So it will mount an immune response. It will mount an inflammatory response. You're going to feel bad, and you're going to say, I am allergic to XYZ food. You're really not allergic to XYZ food, most probably. What's happened is you've got permeable gut that is allowing undigested proteins into spaces where they're not supposed to be. So your immune system is working the way it's supposed to be. It flags those, it tries to attack those, and you get the immune response. So good gut health is really, really important. And we do a lot of gut work here. You should be doing a lot of gut work. Google gut work, and always talk to a credentialed professional, right? So that you can get the information that you need, because everything that you read on Dr. Google is not true. I would say maybe only 10% that you read on Dr. Google is true. So be careful about that. But you do want to get information. Look at PubMed. Look at any kind of EDU sites. Look at any hospital sites. Now, they're going to give you medical information, which we may or may not like, and we may do it a little bit differently holistically, but at least you're getting the information that you need so that you can make the best choices for your body. Now, I told you this is going to be at least a 2-parter and probably a 3-parter. So I'm going to stop right there, because I'm going to get into some specific strategies, and I want to do that without having to take a break. So I am going to say to you goodbye for today. Try and take care of yourself. Do self-care. It is the weekend, and that's what you're supposed to do. And we will reconvene with this next week. So take care. Remember, I love you, and I will talk to you soon.